Have you avoided standing for prolonged periods of time or even going to do activities that require a lot of standing because of back stiffness? Are you tired of waking up in the morning and dealing with a stiff or painful back? Maybe even you feel uncomfortable sitting on softer surfaces or even sitting for a while because your back starts to bother you. Well, if you find yourself in any or all of those situations, I want you to know there's good news. One of the best ways to help stiffness is actually movement, but not all movement is created equally, meaning there are certain exercises that can make you feel really good, and there are certain exercises that can actually increase the stiffness or increase the pain. So in today's video, we are talking about the 3 exercises that can actually help you relieve back pain and stiffness, and the 3 that actually might be making your pain worse, because I want to make sure you're not doing these. Now, starting off, the kitchen sink can be a great place to do your exercises, particularly when it comes to reducing back stiffness. The first exercise is a simple backwards step. Now, the good news about all of these exercises is they are very simple and quick to do. When you're doing a backward step, you'll line up at a kitchen sink or another stable surface. Stand up nice and tall, roll your shoulders back a few times to find a good posture. Think about a small tuck of the glutes. Alternate stepping backwards. Now, depending on how severe your stiffness is, you can absolutely let go of the counter. But if you're not sure of yourself or your back stiffness is pretty bad, then I would recommend holding on to a counter. All I'm doing is taking a small step back. Now, you might be wondering, why does stepping backwards help with my back pain? It's actually in the muscle that's working. As you step backwards, you're actually working muscles of your hip that play a big role in the back. Part of your glute muscles, the large first layer, helps to extend your leg or move it backwards. It's actually been shown that people with lower back pain and stiffness tend to have weaker legs, in particular the glutes. So this is a great way to help work those big muscles, taking some stress and pressure away from the low back. You can challenge the glutes even further by taking a larger step back. For these backward steps, 10 to 20 alternating repetitions for 1 to 2 sets can be very helpful. And while we're talking about joint health, I want to quickly share something that might help. I send out a free weekly email newsletter that's packed with tips to help you find pain relief, inspiration from other followers and subscribers and the wins they've been having, as well as simple exercises to keep your joints moving. It's all designed to help you regain your active lifestyle and find new adventures. It's completely free and has helped so many people take the first step to finally feeling better. Click the link down in the comments to sign up. You have nothing to lose. Exercise number 2 works wonders, especially if you're dealing with spinal stenosis or a disc herniation. And I like to do this at the kitchen sink as well. Hook your hands around the counter leading into the sink so you have a nice stable base. Then make sure you are about a step away from the sink and feet are shoulder width apart. From here, sit your hips back and allow your knees to bend, and then stand up. This supported squat is a great way to help stretch out those back muscles, but also engage the legs, the thighs, and the glutes. Now, we talked about there may be some weakness in those muscles, and it can actually lead to increased stress to the low back. So we are working to fix that by using this nice squat. Now, there is another benefit to a squat at the kitchen sink. While I'm holding onto the sink, this tends to pull my body in a little bit of a forward position. If you have spinal stenosis or a disc herniation, typically your body likes to be in this little bit of a forward position. Now, this exercise naturally pulls you into that position, while working the important leg muscles and helping with mobility. Now with this squat, you are only going as low as feels comfortable and then working to push through your feet to straighten your knees. Again, bring your hips down and then work to straighten your knees and stand up tall. 5 to 10 repetitions of this can be a great place to get started. Now for this last exercise, you can use a variety of different surfaces. You can use the kitchen counter. You can also use, say for example, the edge of a stable couch. What you're doing is placing your hands on the couch or the counter, walking your feet back so you're in a semi-plank position. From here, lift one knee and then lift the other. What this exercise is doing is activating those core muscles and allowing them to work without your back trying to overcompensate. One thing you want to make sure of when you're doing this is not to involve your back, meaning you're adding in back movements as you're doing this. Try to keep as still as possible, only allowing your knee to lift up. You can make this easier by just slightly lifting one heel off the ground and then the other. As you start to feel more confident, you can lift that knee up higher. If it is too hard for you to go down to this low surface, don't worry. You can go to a higher surface and then complete the same exercise. Aim for 10 to 20 alternating repetitions here. Now for the exercises that might be making your back stiffness or pain worse. If you are doing any of the exercises I'm about to mention, it's okay. Unfortunately, these are very commonly prescribed, but we're going to talk through why they might be increasing your symptoms and what you can do instead. This first one is a hamstring stretch, where your leg is typically straight and you're trying to reach as close as you can to your toes with the goal of stretching the hamstrings, the muscles that are behind your thigh. The reason I don't particularly love this exercise is first the positioning. Being in this bent forward position, pointing your toes up and even looking down puts the sciatic nerve on stretch. So the sciatic nerve is now tense in this position. Especially if you're having any sciatica related pain or symptoms, meaning pain that's running down your leg, this can actually exacerbate that because you are stretching a nerve that's already irritated. Another thing is muscles typically tend to be tight for a reason. So doing a static stretch where you're just holding this position, trying to lengthen the muscle, might not be a great idea in terms of improving long-term mobility. Instead, I like to incorporate some movement. For example, this heel lift exercise allows those hamstrings to contract and then relax. Movement can be a better way to increase long-term mobility. I do have a video here that you can head to after this one that dives deep into tight hamstrings if you're dealing with that. So this next exercise is actually a bridge, which traditionally you bend up your knees and then lift your hips to the sky and bring them back down. Now the reason this can increase back pain or stiffness is incorrect form. And here's what I mean by that. Many times your back muscles can become tight, tense, and irritated when you are dealing with stiffness or pain. When you go to do this exercise, you have a large arch in your back, meaning I can slide my hand under here, no problem. If you then try to raise your hips like that, you put a lot of stress and strain on your lower back muscles, increasing tightness and maybe even pain. The good news is one quick fix can help that. And that is being aware of where your lower back is. The best way to do this is to try and allow your lower back muscles to relax, finding the ground with your lower back. I should not be able to stick my hand underneath. Imagine you are squishing something with your low back that's lying right on the ground. If you are having a hard time getting in this position where your lower back, middle back, and upper back are all on the floor, you can just simply try to take a few breaths here and use your heels, push your heels slightly into the ground to allow your hips to tilt back. You can also use your hands underneath your buttocks to see if that can give you a little bit more range of motion towards the ground. Now, once you're able to achieve this position, as you do a bridge, think about this. Bring your lower back to the floor, lift your tailbone up, then bring your lower back down to the floor and allow your tailbone to come down. Bring your lower back to the floor. This is engaging those core muscles, taking stress off those low back muscles. Lift your hips up. Slowly bring your lower back to the ground and then drop your hips. This controlled manner can feel so much better on your back and help you to get more out of the exercise. Now, the last exercise that might be increasing your back stiffness is a Superman exercise, where you are lifting your arms and lifting your legs, making this arched position. Now, the goal of this exercise is to help strengthen those big back muscles, but many times those muscles tend to be overused. They tend to be overactive. So typically, if you're dealing with back stiffness, those muscles need to learn how to relax instead of getting more stress, especially when your back pain or stiffness is at its worst. This exercise also brings you into end range extension. Now, extension is essentially when your spine has this bend in it here, this arch. So it's really bringing you into that end range. This can be irritating in people that have spinal stenosis, perhaps have a disc herniation, maybe even have some sciatica symptoms. Of course, back pain can differ as far as symptoms are concerned and what movements are actually increasing your pain. Sometimes this extension position can irritate symptoms. So if it does, this is one exercise I would avoid. But here's what I would do instead. Getting good range of motion through your back is still important. A seated cat-cow variation can be a great way to get that mobility through your spine. Essentially, what you're going to do is round your back and then arch your back. Round your back and arch your back. This tends to be a gentler way to get that mobility, but it's also pretty easily modifiable. You can go bigger if you want to, or you can just go smaller and just get a gentle range of motion. Movement can certainly be used to your advantage when you're dealing with back pain and stiffness. It's just making sure that you're using the right movement. And if you found this video helpful, make sure to click this circle here so you can subscribe to my channel so you don't miss any new videos. I'm here to help you make your joints feel good again. It's possible. You just need the right action steps. Thanks for watching.